Okay, good afternoon. This is John McNertney here at Green Ocean Global Advisors. Thanks for tuning in. We are here in the last quarter of 2023, which has been a very eventful one in Portugal. But that all to the side, today we're going to be talking about long-term care options. Exactly how does the long-term care industry work in Portugal? So that you, the viewer, can get a little bit better of an understanding of how you might interface with long-term care, and specifically from the perspective of financial planning. So when we talk about these things, sometimes uh, the perspective is you guys are talking about money too much. That's the point. We're going to be talking about how do you navigate this new system intelligently. And I'm going to be featuring a guest who I will be introducing very shortly. Before I start, I do need to give the disclaimer that none of the information which you are about to see can be construed as direct or specific investment advice or tax planning advice unless you have a contract with the firm Green Ocean Global Advisors. If you don't know me, I'm a financial planning professional. I'm about 20 years into my career, and most of it was spent as a private wealth advisor in the San Francisco Bay Area. I was born in San Francisco, and I've lived there for a really long time until about 5 years ago when I became an expert in Portugal. Well, I wasn't an expert 5 years ago. It takes some time to do that, but I've been working on my global financial planning designation since then, and so have a great deal of experience with not only planning but tax planning for expatriates as well. Today, I'm going to be hosting a guest named of Michael Averbukh, MD. Michael is a doctor, and in point of fact, his expertise is focused on healthcare planning, both from the standpoint of traditional sort of day-to-day healthcare planning for expats, not just Americans, but expats from around the world in Portugal. And he is also very focused on helping to create long-term care solutions for individuals trying to navigate Portugal as well. And Mike, are you there?
I am.
He is
Hi,
with us.
everyone.
And so, Mike, why don't you tell
I am.
the folks at home just a little bit more about yourself, and then I'm going to lead in and talk a little bit about financial planning and cut to you.
Well, you said almost all the things, so nothing there to add about myself. But I started Serenity together with my partner, with Rita. She is a Portuguese national. We both come from a background of healthcare management, and we created Serenity as your kind of guiding hand, call it the ways of healthcare systems in Portugal. What we literally do is hold people by their hands while assisting them with the transition into the Portuguese system, be it, as you mentioned before, with simple things like I don't know, what's the best healthcare insurance for you, through how do I fill out my prescriptions, who are the physicians that I'm about to see, and on the long run, how do I take care of my needs when I become older and a bit
Mhm.
less agile? That's the idea.
Okay. So thank you for joining, Mike. And hopefully, if you're watching this video, you can appreciate that having not just a financial professional, but somebody who does this every single day, that's going to be what we hope to bring to you today. And so the outline really quick, we're going to give you a quick introduction on long-term care planning generally and why I, as a financial planner, think that it gets less attention than it deserves. Then we're going to talk about senior care and sort of fundamentals of long-term care planning. Um, Michael's going to then come in and help me with the last half of the presentation, where we're going to give you some fact sets about how healthcare and healthcare insurance work, specifically in Portugal. And then we'll wrap up with some final considerations of some nuanced issues that are going on beneath the surface in Portugal, as well as how you might take this information and execute on it. So, why do we care about planning for long-term care? Well, it matters because we're getting a lot older. In the 50s, we all looked pretty young on television. And in fact, we were a lot younger because in the 50s, only about 8% of Americans were over the age of 65. Cut to 2022, only about 17% of Americans were over the age of 75. So if you think about that, that's a really big deal. Less than 1 out of every 10 Americans was what we would consider elderly. And at this point in time, it's more like two. There's double the amount of elderly individuals in the United States in 2023. And we think about that in terms of raw numbers, that's about 54 million Americans that are elderly, again, as opposed to about 10 million about 50 years ago. And so it is a point of fact that there are just a lot more elderly Americans in 2023. And in fact, when you look at the long-term life expectancy, it bears out, you know, that there has been a little bit of a drop off here, which has been a highly publicized statistic, but we're still living on average to about age 80 in the US of A, as opposed to about 50. Well, that's 100 years ago, but let's be fair. Even in the 1950s, the life expectancy was about 65. And so you tack on 15 years to your life expectancy, and that is a whole lot of extra living that we're doing and having to support. Why do I care about this? Because it's a question of supply and demand. If there are more people chasing the same product, that product being long term care, it's going to drive up your price. And so when I do financial plans, we have to think about how your dollar spends in the future. This is a page from a retirement plan that I've done for somebody. We look at retirement expenses, $4,000 a month. Well, that's going to spend differently over time as a function of inflation. And so the inflation on general expenses for the last 40 years has been about 2.5% in the United States. You look at long-term care and healthcare in general, it's about 5% has been the rate of inflation. Yeah, so the rate of cost of long-term care insurance and long-term care in general has been increasing on the rate of about 5% a year. That's a big deal. And when we think about that expense, it's about $60,000 in today's dollars is what you would spend to be taken care of in a nursing home, which is $120,000 for a married couple. $120,000 spends differently in the future. So if we're to take that 120 and look at how it spends out in the future for our hypothetical couple, Curtis, Sandra, we have a future expense of about $800,000 in just about 20 years' time. So, are you saving for this? Do you have a $500,000 set aside that we can grow into $800,000 in 15 to 20 years' time? You think about that, that's the challenge that we face when we're financially planning for the future. The implication here is we need to save a lot more money. Now, uh, are we? And so there was a recent study that was conducted by the Insured Retirement Institute on baby boomers. Sorry, boomers, but we're going to make an example of you. This recent study concluded that more than 40% of respondents believe that Medicare is going to cover their long-term care costs. That's not true. Your major Medicare is going to cover your drug. It's going to cover your hospital benefits. It's not going to cover long-term care expenses. You need to take out a separate policy for that. Financial planners can help. 70% of individuals who work with a financial advisor have a calculated retirement savings goal, whereas 25% of people not working with a financial planner, no surprise, they're not creating a spreadsheet for this. So they're not going to know how much they need to spend until they're almost there. Only 55% of seniors have money saved for retirement. Less than half of us have any money saved at all. And so we will be at the mercy of the public institutions. Only 23% of individuals ages 65 or 56 to 61 expect to receive income from a private company pension plan. Not surprising either. As the 401k and the IRA plans have come to prominence in the United States, more and more of the onus is on us to do the planning. And as we've just covered, are we doing that? Sort of, kind of, for the most part, not really. And so 60% have taken no action with their workplace defined contribution plans. So half of us are not using our 401k or saving at all. That's a little concerning when we stop and think about the facts that we've just gone through. And so understanding senior care. What kinds of senior care do we need to make use of? Well, I like to think of this in basically three levels. There is the in-home care. So there's those of us that want to age in place, don't want to go to a facility. I can appreciate that. In-home care tends to cost about $5,000 per month, and that's to cover the cost of caretakers, drugs, all the kind of medical uh, care that you can think of one needs in the home. Assisted living facilities, that's the next level up. These are facilities that you think of, you receive some additional forms of support. It's kind of like a dormitory situation, but it's a semi independent style of living. And this actually has the best price tag that's attached to it. This is about $4,500 per month. And then full on nursing home care assistance. And this is where we're thinking of skilled nursing homes. This is round the clock care. This runs about 9,000 a month. And this was the largest price tag that we covered when we were talking about long-term care in the previous slides. How do we fund this? That's the big question, right? There's different financing options that exist. You can use your own funds, which is where I try to direct a lot of my clientele. Let's save our money so that we can have some money saved up for this. Uh, Insurance coverage, which includes long-term care plans. If you're going to retire in the United States and you're under the age of 60 still, you can start investing today in a plan that will pay a specific benefit to you during your long-term care period. Workers' comp, reverse mortgages, Medicaid, if you're on public assistance, can provide some assistance to long-term care, and of course, the use of your saved money in a 401k and your Social Security benefit. So we need to assess your financial readiness. That's what I do every single day, and that just means taking stock of how much you have in savings and investments right now, and thinking about whether it's going to be sufficient to cover your expenses when you get there. Living situation decisions, you got to have these conversations today, if you can, about where you want to be someday, so that you don't have to scramble with your loved ones or on your own, God forbid, when the moment comes. And legal preparedness, have you done your durable powers of attorney? Do you have your will in place? Do you need a revocable trust, not an irrevocable trust, but a revocable trust, so that your loved ones know what to do when the time comes? I have clients who have a financial power of attorney on file with us so that their loved ones can step in and assist with those decisions when the time comes. A lot of topics that we have to think about and that we can think about, but it takes time. So that's the United States sort of wrap up. How do things work in the United States, and what might we have to consider as we're building out our plans? We talk about Portugal. Um, Green Ocean Global Advisors can help, but what we more often do is lean on experts that already know what they're doing. And so we're going to talk to Michael here in just a second. But to set the stage, Portugal, how does it work? And so the senior care landscape in Portugal is it exists, but let's talk about how developed it is. Now, the healthcare system in general is highly regarded. It's highly regarded because in Portugal, you have a lower cost of living, and the country itself then creates less financial stress for you. In terms of healthcare quality, Portugal does rank highly as well. It ranks above Canada and the United States on some independent metrics for how good the healthcare system is in general. I think Michael will speak to this as well. The culture is inclusive of the elderly. Ageism is, of course, a thing, but I have found this as I've lived here. Portugal can be a lot more comfortable from a cultural standpoint. There is a lot of respect for the elderly. And it is possible for individuals to age in place, especially if their family is surrounding them. The healthcare system covers most medical procedures, with pensioners who have paid into Social Security eligible for monthly allowances based on their degree of dependency. Kind of two concepts there. Number one, the healthcare system is publicly subsidized, the healthcare system. So if you need to avail yourself of the SNS, the the system, the National de Saúde. I got that wrong. But if you need to rely on the public system, it's there for you, and that is great. But does it help with long-term care? We're going to get into that in a minute. The question is a sort of qualified yes. And foreigners who haven't worked in Portugal are not eligible for residence in government-funded facilities or for certain tax breaks. Now, that is an important concept that we're going to talk about in a few minutes. And so, what are the key differences between Portugal and not just the United States, but for those of you watching that want to compare Portugal to other countries, what are the key differences? Because internationally, countries like Norway, Sweden, Switzerland, Germany, Canada, and the US, they all have really high quality elderly care. They excel in factors such as pension coverage, healthcare systems, care services, social support, government grants. What's interesting about those countries is they do have more blanketed support for the elderly in certain ways. And so, compared to these countries, Portugal's senior care market is a little bit less developed. It's a little bit less developed, and it places a little bit more onus on the families and on the individuals to sort of take care of themselves or to kind of piecemeal their coverage together in ways that they can. However, there are demographic shifts happening. Portugal is getting more elderly. It's one of the older, I think it's one of the older European countries in general, and it is gradually seeing a shift towards a more structured and diverse senior care landscape, which is similar to developed markets. And that more developed landscape is being ushered in by skilled experts, which brings me to my skilled expert of the day. Are you still here, Michael?
I am
All
all the
right,
time.
welcome. So,
Thank you
Michael,
again.
I'm gonna ask you to chime in on part two of this topic because you have the skills to do so. But before we start moving into the slides, I would love if you could just give us a little bit more about your expertise, a little bit about your background, so people know who you are, and then I'll kind of start taking us through some facts and figures that you can speak to.
Sure thing. So again, thanks a lot. Personal background, again, we already spoke a little bit about it. I'm a medical doctor. My specialty is internal medicine. I'm a board certified in internal medicine from Israel. And coming to what we are doing today, we are running actually a company called Serenity that does medical concierge and case management services. Except for the very nice title, what we literally do is deal with solutions, providing solutions for mainly expats that have arrived to Portugal and need a little bit of a helping hand with finding their way through the labyrinth of both public and private systems here, finding solutions for long-term care. Hey, this is why we're here today. And we see each and every, I can literally go back through your presentation so far and say that we are seeing each and every line, what you have mentioned, every day, couple of times per day, starting with the rightfully well-perceived quality of care in Portugal, on one hand. On the other hand, the lack of a straight line structured system that would support elderly care. It is there. It's just very complicated to get there. And the complication, actually, you know what? It's an important point in our conversation to say it. We have never, through the 3 years that we are active, that Serenity is active, we have never seen a medical issue, a pure medical issue that we could not resolve. Because, as you said, and I just reinforced, the system in terms of quality, ability, skills of physicians, knowledge, updated knowledge, by the way,
Yeah.
all good. And you're just, okay, as everywhere in the world, sometimes it's less complex, sometimes it's more complex, but if you know your way around the system, you will get treated. Whatever you have, the most complicated situations, you will be well treated.
Yeah. If
And
you
on
know
the
your
other
way, though,
side,
right? Like, because
If
if
you
you
know
don't know
your
your way,
way, yeah.
yeah,
If you don't know your way, you're lost. It's exactly like you're having the best car in the world. You can have a Maserati, but if you don't know your ways around a highway, you will not get there. It really
right.
doesn't matter. So you need a Waze, you need a system, you need a Google Maps that would guide you through it. And this is what we do. And on the other hand, when you look at the long-term care, the solutions are lacking. I mean, yeah, it's there. The system kind of is built to support the population of Portugal, which is, as you said, one of the oldest in Europe, actually the second oldest nation in Europe. But so the system is there, but the problem with this system is that it's built on long-term socialistic conceptions that the state will take care of me when I'm getting old. And the state treatment is actually a small puzzle made of pieces of the SNS, the Serviço Nacional de Saúde, the National Services of Health, Social Security, and if you didn't pay for Social Security, you have a problem, and other NGAs, etc., like Misericordia, stuff like that, also social institutions. The thing is that all those social institutions taking care of so many elderly population in Portugal, there's around 20-25% of all elderly people in Portugal living. You can imagine that with money of the government and NGAs, with a little bit of money of Social Security, you have to take care of 2.5 million people or so. The care is not exactly of the high quality that we just mentioned about healthcare per se.
Hmm.
And that creates a situation in which kind of everybody theoretically, you know what, I'll just rephrase it. It's not everybody receives care. Everybody is eligible for care, and whoever receives it in a general, common, low level.
Okay.
Everybody gets a small piece of what they really need. This is the problem of social system.
Yeah.
And the private systems, like you have, for example, in the States, of assisted living, gated communities, whatever, even through nursing homes, you know, on a higher private level, almost do not exist. If you count them here in Portugal, you get to fill out a palm of a hand. That's it. The system, in a way, failed to create the engines behind this growth of private system to support the elderly. If nobody wants to pay because the state pays, nobody develops anything really private. Nothing really private emerges. People are dealing with mediocre layer of care that is paid through the state institutions.
And this is where
Right?
you guys step in to help people to sort of thread
And this
together
is where
their own
we step
solutions.
in and we say, guys, if you really need it and you have the ability and, of course, the will to live those extra years that you have mentioned at the beginning of this webcast. You said there are more years to live. And we say it's not only that there are more years to live, there are more years to live well.
Yeah.
And if you want to live well, let's create solutions. But today, again, repeating again, that the facts are not so well established in Portugal.
Okay. Well, that's a good lead in for what I'm going to do here, Michael. So if you could sort of join me sidecar, and I've done some research that actually supports a lot of what you've just said, but I'm a nerd and I like to do like research studies. My research studies are from the perspective of an outsider, but I think they're educated.
Mm-hmm.
Maybe you can kind of fact check me. So I'll do each of my final slides, and I'll ask for your input at the end of each of them. Sounds good?
Sure.
Yeah? Okay. So when I went out to do research on the Portuguese healthcare system, I got some facts back. The healthcare system includes about 241 hospitals, and about 127 of those hospitals are private. And that seems like there's pretty good hospital coverage. The system dates back to 1979. And so, like a lot of things, there was a revolution in the 70s, and the Portuguese reorganized around their, SNS system, and it operates alongside the health subsystem for specific professions and for private voluntary health insurance services. So you have the SNS and you have private healthcare, and they've been sort of developing along a timeline that started in the 70s. The SNS is free and it's funded through taxation, which again, if we have an American audience, they look at those taxes, they go, oh my God, the taxes seem high, but that's because this is one of the services that's included in what they're paying into. Private health insurance requires monthly payments and co-payments for each medical procedure, of course, and the basic packages by worldwide standards are relatively low, 15 to 20 euros per month, and it goes up from there, of course. And Portugal's healthcare system is known, as you said, for developed infrastructure, good quality of service, patient-centered care, but can be a little bit disorganized and lead to long wait times at times, and higher out-of-pocket spending compared to the EU average. That all seems pretty spot on, I hope.
Yeah, it is very, very, very important to say here. I mean, for sure, for the American audience of ours this time, it's you can name it a better or a worse system. Worse because there are long waiting periods for sure through the public system. Much better because it's cheaper. It's mainly different, right? And as you mentioned, it has a huge amount of benefits if you're seriously sick. There's no such a thing that you are one diagnosis away from being bankrupt in Portugal. It will never happen here, which is a huge relief and a huge benefit if you look at it on the long term.
Yeah.
On the other hand, again, you need to understand how the system works. It's not exactly you dial a phone and you get the doctor on the other side of the line talking to you and then tells you, yeah, come tomorrow, we will chat. That ain't going to happen, for sure, not in the public system. But again, solutions are there and are good.
Mm-hmm. So the system is it has the resources. You just have to know how to navigate and thread them together effectively.
Yep, absolutely.
Okay. Long-term care. So here's where we get to the meat of the matter. Government programs do exist to support the elderly, focusing on keeping them in their homes as long as possible and improving nursing home quality. There are a variety of services like daycare centers, home services, nursing homes. Residential care seems to be on the rise and is increasing. For medical procedures, the Ministry of Health covers costs, but co-payments are required based on income. Tax deductions are available for families. That seems to square with what we know about Portugal. Is you have to keep your mind on those deductions, which figure in to costs. Expats must navigate residency requirements to access certain benefits without contributions to the social security system. So if you haven't lived here, you haven't been paying into the central the social security system, you may be ineligible for certain government funded facilities and benefits. But of course, all residents have access to National Health Service. The challenge for expats, and this is exactly what we've been talking about, involves understanding the mix of government funded and private elder care services. In home care services are there, they're available, but they can be expensive. And private agencies are going to offer more comprehensive care options. And finally, a study on the Portuguese National Network for Long-Term Integrated Care highlights challenges like multiple financing sources, the institutionalization dominance, waiting lists, regional asymmetries. So if you're in Porto versus the Algarve, like there's going to be big differences in the services that are available that you receive. And there's not a financing model based on dependence. Basically, there's not a Medicaid where if you're poor or insolvent, that you can access some of these long-term care services. What do you make of that? Do these seem to also seem true to be true statistics?
Yes, and again, I'll give you the mirroring of everything you said, which is totally true. The mirroring of it in the real life, and in real life, for sure, for expats, right? If you are in need of long-term care, be it home to a certain extent, home-based or institution-based or whatever, you are in a bit of a problem. Again, if you're counting only with the SNS/social health, you're in a problem because you will wait forever when you will get the service It will be very, very basic, very mediocre. Again, pardon me if I'm kind of discouraging people, but it will be pretty mediocre. And when it comes to payments, there will be a complicated calculation that I cannot provision because it will, as said before, it's somewhere falls in between your eligibility for care through the SNS. Every resident has it. And the fact that you didn't pay social security, so this will come out of pocket. And another part of other social support programs that I can't really tell you. Really, I do not know enough how an expat living here for 3-5 years is or isn't eligible for those. Mm-hmm. So you will have a problem with the payment, just a mixture and a mess of how do you support it financially and a mediocre care on one hand. On the other hand, you want to do it privately, you will find huge amount of private companies working today with the government in the provision of care. And if you want to find the good ones out of those hundreds out there, it will be an issue. It will be an issue to find a company that would provide caregivers or assist you with caregivers, whoever they are, that would speak English. And again, if you want to have a high quality service, it will cost you money.
Yeah,
that's the reality. That's the real life of this subject in Portugal today.
So this is an interesting point because when I do financial plans, I point to the long-term care cost in the U.S. and I put a big question mark around it because I'm not really sure if it would apply here. And I'm curious to know, because we haven't talked about this, if you had $700,000 available to you in 15 years, or if you had 60,000, let's just make it easy. If you had 60,000 per person right now, is that the level of assets that you would require, or is that more or less, do you think, that you
It's
would
a
need to?
very, very good question. It depends, of course, on the time frame through which you will need the long-term care. You have statistics that it doesn't normally doesn't long so much. Either you kind of improve, you become better, and you don't need a 24/7 care,
Yeah,
or unfortunately you come to the end of life.
yeah.
Now, if you look at a good, high level, high quality, 24/7 care in Portugal, it would start with around 3,500 euros per month, and it would end at the level of 6,000 euros, right?
Okay, so that's
This
pretty much
is
the same.
in-house. Yeah,
Yeah,
exactly. These are the same prices like you mentioned in the States. Probably in the States, the quantity of proposals and the alternatives are much higher. So the prices play with that. In Portugal, they aren't. So you're paying a very high price for sure for Portugal for that. Not a lot of
right.
Portuguese can pay this money monthly, right?
Interesting. So it must be
Imagine
that the people that are wanting to access that are probably such a sort of an elite group that
exactly.
they're
This
creating
is
their own
why
pricing structure.
this is
Yeah.
exactly the reason why it's not so developed. Because look, a retired Portuguese that worked all his life in whatever public organization, whatever, receives what, 700, 500, 400 euros per month. That's it. He can't pay 3,000 or 4,000 euros for care.
Yeah.
And that's
Interesting.
the thing. If you're talking about institutions, those five that I said, maybe five, that would be fair enough and on high level quality of care, etc., that you will be in a nursing home or pseudo nursing home, you will go to 5, 6, 7,000 euros easily per month. And
Fascinating.
they have waiting lists, by the way.
That makes
But the
sense.
reason being the reason being is that they are very, very small. Talking about 40 beds, 80 beds, something like that.
That
Not
makes
more than.
sense.
It's not like 1,000.
Wow. Well, I'm going to move on just for the sake of time, Michael.
Mm-hmm.
I have a few more slides, and then we'll wrap up and give people some information on how they can find you. Um, so again, I'm primarily talking to the USA. So what I'm curious is pros and cons. The USA versus Portugal. The pros in Portugal, to start, lower cost of living generally compared to many European countries and the US. That's an easy one. Public healthcare system is affordable, with private health insurance costing around 400 to 800 euros per year. That's right. That's really affordable. Patient outcomes and satisfaction levels are high due to the universal care healthcare system. So there's a lot less stress, basically, on all the participants in the system. The Portuguese culture is elderly inclusive, with several governmental programs designed to support the elderly, including in-home and nursing care. So it's not like you're going to feel bereft if you're elderly, as long as you know how to access the system. Cons in Portugal. We haven't talked about this, but I've certainly seen it. Mental health care system and the provision are not as developed as in other countries. There's a huge amount of stigma on being, just depressed in Portugal. I've seen some studies that indicate that it is a hard place to have a mental health issue. Not that the United States is better than this. They're saying compared to other countries, the U.S. is actually not at the top of the chart as far as mental health care, as many of us know in America. Foreigners who haven't paid into the Social Security system, they're ineligible for residence in government-funded facilities and certain allowances. And private healthcare facilities can be quite expensive. We all talked about all these things already, so that shouldn't be surprising to us. Pros in the USA: variety of long-term care options available, including home-based care, community, and residential care. I mean, again, are we surprised? If you have the money in the United States, the variety of options is quite literally staggering. Not just for healthcare, but for just about everything, because you have access to advanced medical technologies and specialists. And cons in the USA, of course, high cost of healthcare and long-term care. Got to have the money. If you think it's bad here or anywhere in Europe, go to the United States and try to get to the top 1%. And the need for multiple sources of funding for long term care, which can be complex and very expensive. Um, any thoughts there, Michael? These seem pretty self evident.
It is. Only a tiny, tiny correction here. Yeah, the private healthcare can cost you 400 euros per year if you're young and healthy. If you're a bit of a, if you're a little bit older, it will cost you more, right? My costs of a very good plan are somewhere in the area of 1,000, 1,200 euros per year. It's not like, you know what, use a very simple rule of thumb. Speaking specifically for the American audience, whatever you guys pay per month, this is what you're going to be paying per year here in Portugal.
Yeah.
So if you're older and you're paying, I don't know, 2,000 euros, 2,000, sorry, dollars per month insurance, you will be paying here 2,000 euros per year. But
I've
it's
seen that.
still a fraction.
Yeah, it's literally a fraction. It's 1/12.
Yeah,
It's
yeah, yeah, yeah.
not the same at all. Excuse me. Differences abound considering the issues beneath the surface. So we're going to talk about some of the more nitty-gritty details of plugging into the Portuguese system. So Portugal has been advancing its policy framework to achieve integrated long-term care services, but the system's fragmented. And I think we've talked about this, that the system does not have a sort of organized, unified front that you can just easily plug into, make a phone call, and get things rolling for you. The growing elderly population in Portugal has led to an increased demand for high quality care solutions and has prompted a private system to start emerging and developing. And that includes some of the things that you see in a variety of other developed countries, which is you can have companionship, different kinds of specialized medical care, live in care, sort of the whole basket of services that one might expect in any developed country. And additionally, skilled nursing care in home health care involves medical services provided by licensed and registered nurses, tailored to your individual medical needs, including dementia, Alzheimer's care. Basically, what this slide is speaking to is that there is no lack of resource, and that is only building as Portugal continues to develop and move up the tech tree, so to speak. Anything that you can sort of pick out on that slide to either validate or knock off, Michael?
No, I wouldn't knock off anything. I'm just saying, yes, it starts to emerge. The demand is there. There's no way that it's not going to go to the right direction. Nobody knows how long would it take. I'm just saying all of the things that you have mentioned and are existing, you really need to look for them. And it's very complicated to do it alone, specifically if you're new to this country and new to the language.
Yeah. I mean, it occurs to me that if you're watching this fresh, you might think, oh, Michael's just plugging for himself. He's not. Because if you don't speak Portuguese, and if you're Portuguese and you're listening to me talk, I speak a little bit quickly, don't I? But the Portuguese speak Portuguese about as quickly as I speak English. And are you going to feel comfortable calling somebody over the telephone and having a developed discussion with them to find care for yourself? It can be not only a technical challenge, but it can be very emotionally draining to try to do all this research alone. I've tried, and I succeed, but it's a question of energy, time, etc. Do you have it? And so this actually brings me to cultural differences affecting the long-term care. Portugal's approach is characterized by a societal culture that values inclusivity. So in America, think about how we think about the Latin countries. That is essentially what we experience in Portugal, is that many older adults will stay with their families, and the government is going to continue to support the structure that exists culturally. And so a strong family centric approach to elderly care is a very central characteristic of the culture here. And in 2006, the National Network for Continuous Integrated Care was established. And so there is a government agency which is enhancing support for private and public facilities for elderly care. And so there is this shift towards institutionalized care that's gradually on the move. And various government programs, like the program of integrated support to the elderly and the program for the elderly nursing homes, has been introduced to improve the quality of nursing homes and to encourage seniors to stay in their homes longer, supported by healthcare family caretakers. So you kind of have the government supporting both approaches, but with this kind of emergent trend of institutionalized care, hopefully higher quality institutionalized care. And so adapting to the Portuguese approach would involve understanding the balance between government supported initiatives and that traditional family based care model. For example, governmental services for in home care include meal deliveries, cleaning, laundry, personal care assistance, and you can have those things supplemented by private agencies. It's important to note that the Portuguese healthcare system requires co payments for medical procedures, which can be higher if you're a pensioner that has not contributed to the social security system. Once again, for expats considering long term care here, you've got to understand the eligibility for those government fund facilities and allowances, and you have to understand, once again, how to access those things. No surprises, once again, Michael. I think we're just repeating ourselves.
Yep,
Yeah.
we are.
Yeah. Sorry, I did the research, and then you could tell I sort of I went deep, but the deeper you go, you don't uncover new things here. Um, there's a growing private sector and technological advancements that are happening. Um, Most of what we have in this slide, please email me so that you can get the more detailed data. But I am going to move forward to the end just for our time and for yours. Email me, call me, call Michael so that you can get more information on the programs here. But just to kind of wrap up, as a financial planner, you got to do some of this planning. Number one, create a realistic budget and manage those income streams. And what I'm talking about is income streams as they come to you here in Portugal are going to support you, but the extent to which they support you, of course, they're going to be eroded by taxes. And that's my bailiwick, is helping people to understand what the tax effect of income and investments will be. And so we want to manage those investments on a continued basis. Want to make sure that we're not taking too much risk, that we're getting the right levels of income from our investments that we want. Um, it's interesting, distribution of funds from tax advantaged accounts. It's going to be treated differently when you arrive in Portugal, so pay attention to that. You want to adapt to differences in Social Security, pension, and income from your home country. Determine how to adjust your health insurance coverage. You're coming from a country where you have a basket of health insurance coverages that you understand. When you move, are they still applicable? We haven't talked about this, but will Medicare still help you in any meaningful way? Talk to us about
No.
that. I wasn't going to give them the answer, Michael. It's true.
Ah.
Yeah, if you pay for Social Security here in Portugal, there's no way they're going to pay for you in the United States, Netherlands, Nicaragua. It's for people that paid into the system where you live. So they're not your Medicare's not coming with you. Uh, Determining how to leave assets to your heirs. This is talking about estate taxes. Does it exist here? Once again, the answer is no. There's a lot of people that come to Portugal for that reason because there's not a death tax. Finding suitable living accommodations for the future, such as retirement communities, that is what we've spent all of this time talking about. And because needs and goals will change, you got to conduct periodic reviews. Michael mentioned Waze, GPS. Do you like to have one map and then have that map apply for a journey that lasts 3 or 4 days? No. If you have someone like us as your co-pilot, we're essentially functioning as a Waze map or a GPS, making adjustments because things will change every single day. My favorite quote from an athlete, we love this in the States, is Michael Jackson, or not Michael Jackson, but my who was the
Michael Jordan.
not Michael Jordan, although I love who was the professional boxer, Mike Tyson. Mike Tyson had a famous quote, which is everybody has a plan until they get punched in the mouth. You have a plan, and then things they happen. And so I'm going to wrap up. We don't have live participants right now, but any thoughts, Michael, before we wrap up here, and then we'll let everybody go on their way.
Oh, I'll just, I think that the bottom line of what we have spoken today is very simple. When it comes to long-term care, you need two things. You need somebody that would help you find yourself within the system and find the proper solutions, proper really for you. And you need a good financial tool, a financial enabler, and you name it, it can be a saving account or whatever, to allow you to have the right choices at the right time. And actually, just to say the last sentence on my side, this is exactly what Serenity is trying to do now. We have seen enough cases in which exactly this conjunction of our knowledge and someone's financial ability could have solved a lot of problems. And we're trying to combine it into a solution of a trust account that will be managed only for predefined purposes around healthcare, home care, rehab, palliative care, end of life, etc., etc.
Now, we didn't talk about that enough, Michael,
Yeah.
but just really briefly, I want to remind anybody that stayed with us, if you're still with us, Michael's company is creating long-term care plans. As we mentioned, long-term care insurance that we're all familiar with in the United States doesn't exist here. And so if you reach the end of your life and you need it, what do you do here? Well, one of the primary considerations, even if you're a person of means, is that you might not have the faculties to deal with all of the issues that come onto you as you're heading into the situation. Michael has been developing something like this. Now, really quickly, Michael, if you can just let us kind of know at a high level what that is, and then they can reach out to you to get more detail.
The idea is very, very simple. You allocate a certain amount of money. It's not supposed to be a huge amount of money, for sure not the $500,000 that you spoke about in the States, but you allocate a certain amount of money for the rainy days when and if they appear. There's a predefined list of what this money can be used for. And this trust fund is actually on the name of Serenity, is your trustee. And we will execute it with our best of knowledge in terms of professional assistance and guidance towards the right solutions when and if needed. And as I said before, it practically covers everything that your insurance doesn't cover. There are some lacunes between what health insurance provides here and what you might need. And exactly in this empty space, in this void, that we want to step in with the solution of a trust account. There's money, it's your money, nobody touches it. You'll give us the directions what to do when and if, and we will execute.
So this is elder care fiduciary, essentially. I haven't actually encountered a lot of things like it in Portugal. If you'd like to know more about having elder care fiduciary guidance, definitely reach out to the folks at Serenity. I have clients that have used them, and I could say this: they have been super satisfied. But I leave that to you to decide. That's it for us today. Thank you for spending some time with us. Thank you, Michael, at
Thank
Serenity,
you.
for stopping in.
Pleasure.
Yeah, and happy trails. Take good care.
Bye bye.